Let's see. Okay. Miss Zhong. Yeah, calling on you first. Calling on you first because you are going to tell me the name of this muscle.
Rectus femoris.
Yes. And what? Oh, never mind. Let that go. I want to stick with you with quads right now. You're good. That was good. Rectus femoris. We'll take it all day long. Thank you. Miss Allure. Thank you. Miss Allure, what muscle is this?
Subscapularis.
Well, you named a rotator cuff muscle, and I'm glad about that because this is a rotator cuff muscle.
Wait.
But it's not the subscapularis because the subscapularis is under the scapula.
Oh yeah, that's right. Supraspinatus, ain't it?
Yes, supraspinatus. What action do you suppose that muscle would create?
Is it abduct? Yeah, abduction.
Abduction of what?
The shoulder?
Yes. And what's the fancy name for the shoulder? Because you're doing so great right now.
Glenohumeral joint.
Oh, Miss Allure. Oh my gosh, they grow up so quick. Yes, you are amazing. That is the supraspinatus rotator cuff muscle. It creates an abduction of your arm, and many people believe it actually initiates the shoulder action so your deltoid can kick in. Which might have been on the homework last night even, somehow, strangely. But anyway, that is its job. That was wonderful. Thank you, thank you, thank you. Mr. Blygen.
Yeah.
What is this?
Cord brachialis.
Yes, sir. Can you give me an action of this muscle? I can think of a couple, but I just need one.
Okay, hold on. Let me look a little bit closer.
Cool.
So it looks like if it contracts, it will help with medial rotation of the GH joint and flexion of the
Flexion.
flexion of the arm
Yeah, flexion of the glenohumeral joint.
of the GH joint.
Yeah, nicely done. I don't know about the medial rotation because it's actually hooked to the inside of the arm, but I liked your logic. If it was up here, it would, but it actually hooks here. But anyway, you got the right idea. Thank you, sir. That was good. Mr. Brown.
It looks so fat.
Yes, Mr. T.
Mr. Brown. Mr. Brown, what muscle group is this?
That is the. Isn't that the erectors?
Yes, rectus spinae group. What action do they perform if they bilaterally contract?
Bilaterally. Is there a layman's term for bilaterally?
If both sides contract, because they're down both sides of your back. So if both sides contract, that's bilaterally.
And another question. Is adduct the one that comes to the midline, or is that going away? Because wouldn't they bring the scapulas together?
Well, it would have to really be hooked to the scapulas to do that. It runs up and down the spine. It's probably going to do something to the spine.
Oh, the spine.
Yeah, that thing. What?
Go ahead.
What might it do to the spine? I'm using mine right now, and it's kind of ridiculous at this point, but what might happen if it bilaterally contracts behind me?
Extension.
Yeah.
It's in the back.
Extension of the spine or the vertebral column. Good job, sir. Thank you.
The spine.
Yeah, that was good. Thank you. Ms. Estes, what's this?
Those are the rhomboids, major and minor.
Which one's more superior?
The minor.
Good. Okay. And what action do they create? There's actually two, but I'm looking for one in particular.
They retract the scapula.
Yes, you were 100% correct, ma'am. That was great. Can you give me another word for retract, even though retract is perfect?
Sure. They extend. No? Abduct. Abduct. Adduct.
Yes, good. They add the scapula closer to your spine as they retract it. Yes. Adduct the scapula. Cool. And by the way, I don't care about this part, really, to be honest with you, but because they run in a diagonal, they slightly elevate the shoulders too. But you were answering the one that was important. Thank you, thank you, thank you. Miss Hawks.
Hi.
Hi. Miss Hawks, what muscle's this?
Is that the levator scapula?
Yeah. What action does it do?
Elevate the scapula.
Thank you, Miss Hawks. I was going to make fun of you if you didn't say that because it's in the name. That was fantastic. Thank you. Hey, Mr. Placencia, where does this muscle insert? Its origin is on the medial border of the scapula between the spine of the scapula and the superior angle of the scapula, but it inserts where?
The transverse processes of the cervical.
Yeah, cervical vertebrae 1
Vertebrae.
through...
1 through 4?
Yeah, good job, sir. Thank you. Miss Carodi. I don't know if I really like that picture. Miss
That's
Carodi.
my favorite muscle, trapezius.
Yes, if you said trapezius,
Yeah.
good. What action do the upper fibers of the trapezius do?
Salty?
Maybe, Miss Carodi, maybe you don't know.
I don't know.
I don't know.
I thought the arm. The arm.
What, Miss Carodi, can you see me?
Yeah. Hold on. Yeah. Elevate scapula. Elevate.
Yeah, elevate scapula. They're up here, and so they elevate the scapula. Good job. Thank you, ma'am. Upper trapezius elevates the scapula. Miss Lobitz, what gluteal muscle is this?
The pectoralis major.
Yes, ma'am. It's really got a lot of actions. Can you... Wow. Can you tell me what horizontal action it can create? If my arms are out like this, what horizontal action does it create?
Horizontal flexion.
I don't think there is such a thing.
Oh.
But,
Are you sure?
yeah, I'm pretty sure. I mean, I've been
Me-
teaching. So,
I don't see you going at this then.
No, it's so my arms are way out here. They're way away from my midline.
Mm-hmm.
Now they're very close to my midline.
Oh, horizontal adduction.
Yeah. Well, there is a horizontal
I'm
adduction.
assuming I was thinking of, yeah.
Well, you did it too. It was really cute. You're like, yeah. Anyway, horizontal adduction. Cool. And what do you suppose the upper fibers do? The upper fibers actually run down. So what do you suppose the upper fibers might do?
Wait, do that again. Oh, flexion?
Yeah. Yeah.
Okay.
Yeah. And the lower fibers can actually help with a extension even in some ways, but that's good.
Mhm.
Awesome. Thank you, ma'am.
Yeah.
Miss Zhong. I'm calling
Hi,
you again.
hi,
Hi.
hi.
What muscle is this?
热疼。对，Vast 是inter 说上不来的 inter 拉
You're right. Vastus intermedius.
哎呀 intermediate
No, good. I'll come back to you. That was excellent.
Yeah.
Vastus intermedius. I love it. I love it. I love it. Miss Mares, what muscle is this?
Is that the teres minor?
Miss Mares, it's the teres minor every day of the week. Good job. Do you know what action it creates? That's not so easy, by the way.
Doesn't it, wouldn't it like rotate? Like
It does.
laterally rotate?
It does. Did you say laterally rotate?
Yeah. Oh no.
You do not seek to impress. You do not fail to impress. That was fantastic. Yes, it's on the outside. It actually laterally rotates my arm out. Yeah, that's beautiful. Thank you, ma'am. Could not have said it better myself. Miss Mejia, what muscle group is this?
The hamstrings.
Yeah, probably. What are the hamstrings from lateral to medial?
Biceps femoris, semitendinosus, semimembranosus.
Yes. What are the two actions of the hamstrings?
They extend the hip and flex the knee.
Thank you. There are 3 hamstrings with 4 heads. Which head does not extend the hip and only flexes the knee?
The short head of the bicep femoris.
Beautiful. Which hamstring inserts into the pes anserinus that can be found on the medial proximal shaft of the tibia?
Semitendinosus.
Yes. What is the nickname of the hamstrings?
The walker's muscle.
Yes. How many foot-pounds of pressure can a hamstring deliver while moving 35 miles per hour in a train?
A lot.
A lot is right. Wow, you're amazing. No, that was awesome. Thank you. I couldn't think of anything else to ask you. I had to make up stuff. Thank you, ma'am. Mr. Placencia,
Yes,
what is this muscle?
that's the vastus lateralis.
Yeah, where does it insert?
Honestly, I don't know.
Cool. It inserts into the same place that all the quads insert. Does that help at all?
Oh, okay,
Yeah.
The inserts the tibial tuberosity via the patellar ligament.
Awesome. Which means, what kind of action does it perform?
It performs an extension of the knee joint.
Yep. And what's the knee joint called?
The knee joint, the scientific name of the knee joint is the femur. I don't know.
Yeah, you actually just about said it. Just flip it and say tibiofemoral.
Tibiofemoral.
Beautiful. And you knew it. I'm really happy. Thank you, sir. I'd ask you something else, but I don't know what else to ask you about that muscle. Mr. Riedel, what is this muscle in red?
Is that the adductor magnus?
It is the adductor magnus, sir. How did you know that?
I guess.
Okay, well, it was a very good guess. You could also know it's on the medial. It's on the medial thigh and it's in back. But that was good. What's its main action, sir?
Adduction.
Yes, adduction of the hip or the coxal joint. Thank you, sir. Miss Sarno. Oh, Miss Sarno. Yeah, you better get back here. What muscle is this?
Gracilis.
That is the gracilis. What action? What does the gracilis do?
Adduction.
Adduction of the coxal joint, yes. And where does it insert? Where does it go down and hook onto on the leg? Do you know?
In like in the I something like
In the pes anserinus. Yeah, and it's in the tibia on the inside of the knee there.
Yeah.
But pes anserinus. Good. Good job. Thank you, ma'am.
I just turn off the water irrigation. What I get, I just turn off and.
Yeah, no, it's fine. You're fine. We're good. Miss Zhong. What muscle is this down here?
Yes. Vastus medius.
Yeah! Vastus medialis. Vastus
Yes.
medius. Vastus medius. You're right. I'm wrong. Good. Thank you, ma'am.
Thank you.
Vastus. Oh, medialis. Vastus medialis. We'll take it. Either way. Mr. Tate. This is a tough one. Mr. Tate, sir? Mr. Tate. You there?
You can see me, but you can't.
Oh, I can hear you now.
Yes, I'm here.
Do you know what this muscle is?
It's an adductor.
It is an adductor. Already happy about that.
Yeah. Okay. So then it's gonna be the adductor. Is it longest?
I don't mean this, but does it look long?
No, it doesn't. But the longest doesn't look long to me.
I agree, sir. But
is it the Popliteus?
I would say it's either the pectineus or the what? What are the two choices?
The two choices would be
because I feel like there's three we can eliminate. Is it adductor magnus? Does it look like a big, massive muscle in the back medial part of the leg?
No, it doesn't.
So, and is it gracilis? Does it go down the leg and across the knee?
No, it's not that one either.
And is it the longest, which is at least moderately long? So what two muscles do we have left?
I can't think.
That's okay. Do you want to say all five? 5 adductors?
No, I don't. I really don't. Is it because
you're gonna have a hard time answering this.
Michael, could I help him?
So it's not. No. It's. I think I can. No, go ahead, help me.
No, stop.
Yeah.
At this, with all due respect, if you're stuck, you do need to be able to name the 5 adductors at this point, and you can. I know you can.
Okay, so it's the adductor I can do it. Mr.
I know you can.
So adductor magnus, the pectineus, the gracilis, the longus, and the brevis.
Cool. So
it's not the brevis. It's not the magnus.
What could
it's
be
not
the
the
brevis?
longest. Is it the brevis?
What could
I
be
thought the brevis was the one that spans out.
Yeah, no. I'm just trying to point out that to somebody looking at it quickly, it could be the brevis or the pectineus. Those are very hard to tell the difference of because they're both small. That's all I was trying to make the point. I think you're probably right that it's the pectineus.
Is it the pectineus? I'm sorry, it's just that location that gets me confused. So, and the longest doesn't seem that long to me, so I get twisted around when it comes to those.
Did you see the slide?
Adductors. I see it's pectineus.
Yeah, good job. What's the action of the pectineus?
Doesn't it adduct the hip?
It does, sir. Thank you. That's good. That's really good. Where was that? Miss Trotter. It's your favorite time when I call on you. I know how much you love that.
Of course you're giving the one that I never know the name of. I know it's the IT band, but I can't remember the muscle.
Good. Well, the IT band is what they're going to tell you here anyway. But what is that muscle? It's a muscle that's designed to tense up. Because, by the way, when you tense up the IT band, that helps protect your knee. That's honestly its job. So it tenses up the IT band, and the IT band is really just a lot of fascia.
It's a tensor fasciatus.
What a good name for that muscle. I love it. Awesome. Can you tell me an action of that muscle since it's in front?
It helps. I want to say flex the hip.
That's funny because guess what I want you to say?
Flex the hip?
Yeah.
Okay.
You're saying what I want you to say. Yeah. It'll do other nitpicky little things, but we care about it because it's a hip flexor, so therefore it can create tilt in the hip and all sorts of stuff.
Yeah, I was just trying to remember where it inserts it at, so I couldn't remember if it inserted all the way up at the hip or if it was a little bit down.
It inserts on the crest of the iliac crest right behind the anterior superior iliac spine, right behind that bump on your hip.
Okay.
And so, yeah, it crosses over the hip. Well done. By the way, Ms. Trotter, I really appreciate something that you model for us, which is just trying to work it out loud, right? It's not just about memorization. So I like how your brain is working. This is very good. Thank you.
Yeah.
Thank you. Ms. Routson, if you have, there you are. Good. Ms. Routson, what muscle is this?
Internal oblique? No. Wait, yes, it's just a terrible picture. right?
Is that your final answer?
Let me do the gang sign real quick.
Look at the directions of the fibers.
Internal oblique. Final answer.
Final answer? I wouldn't pick internal oblique.
Okay. External oblique.
Final answer?
Final answer.
I wouldn't pick external oblique.
Okay. Asking for a friend.
No, what are the other, it's an abdominal, so what are the other abdominals?
Well, it's definitely not the rectus abdominis.
Correct.
Is this
It's
a
not
picture of transverse and it's just cut?
Well, are the fibers running across? Kind of like around the waist there?
Yeah, sorry. I'm on my phone, so the picture's sideways.
That's okay. So yeah, so with transverse
Like
abdominis.
a barrel. It looks like they're wrapping around like a barrel.
Yeah, and like going transverse across the barrel, transversing it.
Yes, so it is transverse abdominis.
Bam! Awesome. Thank you. Thank you. Hey, do you know what the point of the transverse abdominis is? Like what it does?
I thought it was just kind of to hold everything in place there.
It is. It's like the weightlifter's belt for your body. Yeah. It makes all the other abdominals strong. It creates internal pressure to keep your back locked in. Yeah. And everybody, by the way, it sounds weird, but it wraps around your body. So in a way, it's like a giant sphincter muscle. This is a sphincter muscle that I can close or open. And it's kind of like that too around your waist. Yeah. Thank you, ma'am. Good job. Good. Miss Vincent.
That is the sciatic nerve.
It is. What muscle is on top of it here that could be pinching it?
The piriformis.
Yes, and that is part of what muscle group?
The hip flexors.
Yeah.
The
deep six.
Yeah.
Or the lateral hip
rotators.
Rotators. Yeah. What are the names of these 6 lateral hip rotators?
I'm not confident with that.
Okay. Well, you just told me one, right?
Yes, the piriformis, then obturator, internus, obturator, externus.
Yep.
Gemellus and
gemellus.
Oh, there's gemellus inferior.
Sure.
Superior and inferior.
Yes, good. And then a four-sided muscle found on the femur.
Quadratus femoris.
For somebody who wasn't confident, you did pretty darn good.
Yeah.
What is the action of the deep six?
To laterally rotate
the hip. Yeah. Awesome. Thank you, ma'am. That was great. Miss Walker T.
Yes.
Miss Walker T, what muscle is this?
The adductor brevis.
Yes. I actually would have known that, but thanks to Mr. Tate, he eliminated the one that I would have confused it with. So it is the adductor brevis. What's the main action of the adductor brevis?
Adduction.
Yeah, of the what?
Of the hip.
Yeah. Thank you, ma'am. Thank you. Miss Walker Y, what is this muscle?
Iliacus?
Yes, it is the iliacus. And what action does the iliacus create?
Anterior tilt.
It does do anterior tilt. And what would it do if it, I mean, that's true, but can you kind of give me a different name for anterior tilt? Like, what does it do to my hip joint?
Flexes it.
Thank you. Yeah, both are true. Thank you, ma'am.
You're welcome.
Okay, here we go. Miss Allure, what is this muscle?
Serratus anterior?
It is. What is the action of the serratus anterior?
To Is it to?
This one's tricky.
Is it flexion?
No, it's going to move the It's attached to the scapula and it's hooked to your ribs. And so if it's going to pull your scapula forward, but I don't know what we call that.
Let's see.
What do we call it?
Depress the rib?
No, I like where you're going, but that's a different serratus for one thing. But if I pull my scapulas forward, if they're behind me and I pull them forward, I'm doing it right now actually. What do we call that?
Let's see.
I mean, I can think of a couple of things.
Protraction?
What did you call it?
Is it protract?
It is protraction. So now I'm going to ask you kind of the same question I asked Miss Estes in a way when she was talking about rhomboids. It's the opposite question, but what's another name for protraction? As my scapulas come forward and get further away from my spine. What's another name for protraction?
Abduct.
Abduction. Thank you, ma'am.
Mm-hmm.
Yeah. Very cool. Everybody, by the way, they also run a little bit downhill, so there is a little bit of depression there, but that's fine. That was the answer we needed. Mr. Blygen, what muscle is this?
The psoas major.
Yeah. What's its main action, sir?
Flexion.
Of
the hip.
Yeah. Where does it insert on the femur?
On the lesser trochanter.
Thank you, sir. Mr. Brown. Oh, that's it, sir. Mr. Brown, what muscle is this?
Is that the spinalis?
Is it attached to the spinous processes on the vertebra?
No, it's not.
No, it's not.
That's a part of the erector spinae group, though.
It is. It is. You're in the right ballpark.
Okay, so the spinalis is the most medial.
Yes, that's true.
Next is the longissimus. Is
Yes,
that the iliacostylus?
It is. And you just said the muscle that attaches to the crest of the ilium, your hips, and costalis means ribs. So it's the hip rib muscle, and that muscle looks like it's attached to your hips and your ribs. Iliocostalis. Sir, if that muscle, it's kind of fortuitous that you got asked this, if that muscle bilaterally contracts, what action will it create?
Does that one also extend the spine?
Yes, sir. They all work together to extend the spine. Cool. By the way, what would you think it might do if it unilaterally contracted just one side?
Would that bend you to one side?
Yes.
At the spine?
When we're talking to like doctors and stuff, what do we call bending at the spine to one side?
I don't know the terminology.
All right, I'm moving. Am I moving? Which direction am I moving here?
Hold on. I can
Just the
only
direction.
see
Just the direction.
rotation. All right, do it one more time.
Direction am I moving?
Medial? No, direction is to your. Damn, the picture.
Hold on a second. This will help you, sir. Now I'm going to move medially. So which direction?
Oh, you're moving laterally.
Okay, so I'm doing a lateral flexion.
Oh, lateral flexion.
Yeah, that's what they call it that way. Good job. That was good. I'm serious. Thank you, sir. Miss Estes, what muscle is this? You just disappeared.
That is the longissimus.
Yes, it is, ma'am. It's the longissimus. If it acted bilaterally, what would its action be?
Bilaterally, it's gonna extend the spine.
Yes,
the
ma'am.
vertebrae.
If it, it's beautiful. Yes, 100%. If it acted unilaterally, what might it do?
It would do one of these lateral flexions.
Yes, that's exactly correct, though. Lateral flexion. It inserts where?
In the Mastoid, or what? No, what is this?
No, you're correct, ma'am. Just keep going.
Am I?
Yeah,
Mastoid process? Or
yeah, mastoid process, which is a bump on what bone?
jaw bone. They're the mastoid
The
bone,
mask.
right? Masseter bone. What? I don't know. Mandible. Mandible.
So this thing connects to my mandible?
Does it?
No. Mastoid process is a bump on your temporal bone.
Oh, okay.
And by the way, I shouldn't make fun of you because we haven't even really learned about temporal bone, but yeah. And the reason you thought jawbone is, by the way, my temporal bone also does meet with my jawbone to make my
And it starts with an M. Yeah, I was just
mandible, mastoid, yeah, all that kind of stuff. Very cool. Thank you. Oh wait, whoa, before we let you go, because I'm having so much fun. Can you name 2 other muscles that insert into the mastoid process of my temporal bone?
the sternocleidomastoid mastoid.
Boom. Yep. Some people say that actually argues with the longissimus. So that's cool. And then there's one that goes from my spine to my head. It kind of bees out like this in back here.
Yeah. So, with the sub.
No, not the suboccipitals. This is like a spinious.
Yeah.
This is my head.
Yeah. What's it called?
What would I call it? Spine head muscle.
Spinous. Oh, what was it?
You know what'll help? Put on your thinking cap. That'll help.
Capitis. Splenus capitis.
Splenus capitis, yeah! Awesome. Good job. Thank you, ma'am. Thank you for going through that with me. That was good.
Yeah, thank you.
Ms. Hawks, what muscle is this? It's a poor representation because it only shows the lower part on the right-hand side and the upper part on the left-hand side. But what muscle is this?
I think you gave me this one yesterday.
Yeah?
It's the spinalis.
Well, you were right yesterday and you're right today. What action does it create when it works bilaterally?
Bilaterally, it will extend because it's on the back.
Yeah, extend the spine, yes. What does it do if it works unilaterally?
It will laterally flex.
Thank you. Beautiful. Good job. 2 days in a row. Oh my gosh, I can't ask Miss Carodi this again. Well, actually, I'm going to. Miss Carodi, what is this? It's half of it. It's half a muscle.
It's a trapezius.
It is the trapezius. Hey, what do the upper fibers of the trapezius do?
Activates the scapula.
Elevate the scapula. What do the lower fibers do?
Depress the scapula.
Yeah. Okay, let me ask you one last question. What do the middle fibers do?
The retract the
Scapula. Retract the scapula or adduct it. Beautiful. Thank you. Thank you, thank you, thank you. Miss Mares, what muscle is this? I have a feeling you know.
Yeah, it's the rectus femoris. No?
I know
wait a
why
minute.
you said what you said.
Oh, no. It's sorry. It's the it's an abdominal muscle, right?
Yes. And you told me a muscle, rectus means up and down. You told me a muscle that runs up and down the thigh. I want a muscle that runs up and down the stomach.
Abdominis.
Yeah, so what do we call this muscle?
The rectus abdominis.
Beautifully done. What action does it have, ma'am?
It flexes the abdomen.
It does. That's actually really. It flexes the vertebral column or the spine,
Yeah,
but
the
you are absolutely
vertebral
right. It flexes the abdomen. I love it. Thank you. Thank you. Thank you. Miss Mejia, what is this muscle?
That is the pectoralis minor.
What are its origins and insertions? I don't care which is which, but what are its attachments?
Its origin is the coracoid process of the scapula.
Yes, so it actually attaches to the scapula, yes.
Ribs 3, 4, 5.
Oh, I love you did the whole thing, ribs 3, 4, and 5. That was 100% textbook accurate. Thank you. What 2 actions does it produce of the scapulothoracic joint?
So this one.
would happen if that thing shortened. Do it to yourself. Kind of go.
Does it medially rotate the glenohumeral joint?
Well, does it attach to the humerus?
No, it's on the scapula, but the scapula attaches to the arm.
Right. So it will drag the arm along for a ride. It'll drag the arm along for a ride, but it doesn't create an action with the arm. It creates an action with the scapula.
Protraction?
Yes. What do we call that too?
Adduction? No, it's not. Protraction. I can't think of the name.
Well, as my scapula comes forward here, does it get further away from my spine and back?
Oh, abduction of the scapula.
And by the way, protraction is just as good, but I'm trying to train you guys to use lots of different language. So protraction of the scapula or abduction of the scapula is incredibly correct. What else can you tell by the direction of these fibers that this muscle...
Depression of the scapula.
Yes. That sounds an awful lot like another muscle that's kind of in front that can protract or abduct the scapula and depress it.
Serratus anterior?
Yes, and that's why they work together. Thank you. Really well done. Really well done. All right, we're just about done, everybody. Bear with me and we'll take a break. Mr. Placencia.
Yes, sir.
What are these muscles?
Those are the multifidi and the rotatories.
And what is the difference between them?
The multifidi go all the way down to the surface of the sacrum.
That's, yeah. Is there another difference?
Yeah, the distance they span.
Yeah, good.
I don't know the exact distance, but one of them span. I think the multifidi span like 2 to 3.
2 to 4, they say, and rotatories 1 to 2.
1 to 2.
I always kind of remember they're twice as long. I don't actually think it's an important point to a massage therapist, but yeah. The fact they get down on the sacrum is really important. Well done, sir. Thank you. They're basically tie the vertebrae together. Okay, Mr. Riedel, what are these muscles here? This muscle here?
The splenius capitis.
Really close.
Semi-splenius
Yeah,
capitis.
semispinalis capitis. That was really good. What's the nickname for this muscle?
The speed bumps in the neck.
Yes, and just looking at it, if it contracted, what sort of action do you suppose it would create?
Extend the skull.
Yeah, I don't know what we call it, but like extend the upper vertebral column or whatever, but you were dead on right. Thank you. Miss Sarno, what muscles are these? What muscle group?
Look like occipital.
Yes, they're the suboccipitals.
Yeah.
You're right. And by the way, guys, I don't ask you guys about actions on these because they're kind of skitty wampus. It helps you tilt and bend and little actions in here. But basically, it ties your skull to C1 and C2. It kind of screws your head on there. Well done, Ms. Sarno. Really well done.
Thank you.
Thank you. Mr. Tate, what muscle is this?
It is the trapezius.
Excellent, sir. What do the upper fibers of the trapezius do?
They elevate the scapula.
Yes, 100% correct. What do the lower fibers do?
They contract the scapula. They bring them together, so they adduct them. Or they
Well, they
depress them?
do actually a little bit. They are actually angled down. They do bring them together a little bit, but I don't know.
Right.
This thought kind of, I don't know. Just the answer kind of bums me out a little bit. Kind of depresses me.
Does it? Oh, depression.
Yeah, they depress the scapula.
It
What
depresses
do the middle
scapula.
fibers do?
Oh, you know what? I thought you had just asked me what the middle fibers did. That's why I said what I said.
Oh.
So the middle fibers contract the scapula together. They adduct them together.
Beautifully said, sir. Excellent.
Is that
Thank you.
clear?
Yeah, it was beautiful. It's
Yeah.
great. Fantastic. Miss Trotter. Oh, I didn't know it was going to be in here. I'm sorry, Miss Trotter. I really didn't. What action is this? I will demonstrate it for you because I'm a master body worker. A lot of you can't do this. Wait for it. Here it's happening.
It's a supination.
It is a supination because if I continue it, I can hold soup in my hand. Thank you. Supination. Awesome. We're not doing that. Okay. Miss Routson, what action is this? And they are talking about an action at the glenohumeral joint. The arm is just bent for demonstration. But I will show it to you. What's this action?
Lateral rotation?
Yes! Good job. Lateral rotation. Really well done. Thank you, thank you, thank you. Miss Vincent. What muscle is that?
Quadratus lumborum.
Excellent. Well said, too. I like it. With such confidence. What does it do when it works bilaterally?
Extends the spine.
Yeah, it does. Yeah, extends the spine. The lower spine, but it does. You're absolutely right. What do you suppose it does if it works unilaterally?
It
I can think of two different ways to say this in some ways.
Layman, the word that comes to mind is like twist, and I'm trying to think how to say that.
But think more bend. Think more bend to the side.
Then laterally flex.
Yeah, laterally flex the lower spine there, or elevate that hip. That side of the hip. Same side hip. Well done. That cat is freaky. Okay. Miss Walker T, what muscle is this?
That is internal obliques.
Yes, ma'am. That is internal obliques. Thank you. Miss Walker Y, what muscle is this?
Sternocleidomastoid. No. Nope. Just kidding.
I can give you some choices to pick from if you want.
Yes.
Okay. Is it the gluteus maximus? No. Oh, okay. Is it the gemellus superior or gemellus inferior?
Absolutely not.
Is it your gastrocnemius?
No.
It could be your external obliques because of the way the fibers are running.
Definitely not.
What does it look like it connects to? Maybe that'll give us some clues.
The occipital and the sternum. Or
So
the
connects to
clavicle. Oh, the clavicle.
the clavicle and the sternum and this bump up here. It looks like the mastoid process. I don't know.
I don't know the full name. I'm sorry.
Let's just, you know what? It's frustrating to all of us. Let's just call this the sternum clavicle mastoid muscle. How about that?
Sounds good to me.
Okay. Could we maybe make that name just a little bit nicer though?
Sternocleido.
Mastoid. Yeah, it's what you were going to say in the beginning. That's why I was giving you such a hard time. You started to say that in the very beginning. Sternocleidomastoid. If it works bilaterally, what action does it create?
It flexes the neck.
Which is why it's nicknamed the
Prayer muscle?
Yes. Yes, Hey, one last question. Sorry, ma'am, but what other two muscles that you know about, we're going to learn about a fourth one later, but what other two muscles do you know about that insert into the mastoid process? Of the temporal
the levator?
No, levator scapula is close. A lot of people seem to like to say that, but it's not.
Oh, is it one of the spine erector spinatus?
Yeah.
Yes, longissimus.
Longissimus. That's the best answer right there. So longissimus and sternocleidomastoid both insert in the same place. And then there's this muscle in your back that kind of comes off the spine and goes to the head.
Trapezius?
Yes, that is true. But kind of goes from the spine to your cap.
The splenus capitis.
You're awesome, ma'am. Thank you. Thank you. Okay. Miss Allure, what muscle is this? Miss Allure.
Sorry about that.
That's okay. What muscle is this?
Biceps brachii.
You're wrong, but you're in the right area. This is under the biceps brachii. Because the biceps brachii goes across the shoulder.
Oh yeah, that's right.
This is the powerhouse underneath the biceps brachii.
Is that the core?
No. Starts with a B.
Bicep from
Bray.
biceps
No. Bray.
brachialis.
Yes, ma'am. Brachialis.
Sorry.
What is the one and only action of the brachialis?
Flexion
Yes. Flexion of the what?
of the elbow.
Yeah. How do we talk about the elbow? Like, what's the fancy word for an elbow?
Fancy word for the elbow.
Like, what two bones come together to make your elbow?
The
So what's your arm bone called?
the humerus,
Yes. So this is the humeral.
gleneal
No.
joint.
I got what you're going with that. That's up here. It's in your head.
Okay.
But where my humerus meets my ulna is my elbow. So it's my humeral ulnar joint.
Humeral ulnar joint.
Good.
Okay.
Cool. Thank you, ma'am.
Mhm.
Hey, for all of you, by the way, and I get the feeling you're fine with this, so I just want to remind you again, we're just training. I don't want you to ever, it's my job to kind of poke at you now, especially as you get close to graduation. So, but we're all doing excellent. I'm not just saying that to be positive. I feel very good about where we're at. Mr. Blygen, what action is this? This is just a person doing this.
Pronation.
Well,
Oh,
actually,
sorry.
yeah.
So is that pronation though, other than what you just did?
No, because even if he was doing this, what's this?
Medial rotation.
Yes, sir. And thank you for seeing the difference. There's a difference between me doing this. This is pronation with my forearm. This is medial rotation with my arm. But you're right.
Okay,
I think
so
they're the
then
same
that's
flexion.
That's not flexion of the
Yeah,
flexion of the shoulder.
but you were wrong for the right reasons. Does that make sense?
Yes.
Yeah.
Flexion of the glenohumeral joint.
Thank you, sir. Mr. Brown, what is this?
Did you ask me, Mr. Touchback?
I sure did, sir. This
Repeat
guy's
that again, please.
Yeah, this guy's doing this. What's he doing? What action?
That's a rotation?
It is a rotation. What kind?
Medial rotation.
Yes, sir. Really well done.
Ah, got it.
Yeah, you guys are doing good. Thank you. Miss Estes, what's this?
Deltoid.
Yeah, where does it insert into?
The deltoid niche.
That was pretty good. Deltoid tuberosity.
Tuberosity. I should have said that. I was gonna say that. I didn't.
But you
Anyway,
did. You said niche instead, which I like.
I know. Okay, tuberosity. Okay.
Oh, deltoid tuberosity is found on what bone?
The humerus.
Cool. Okay. And so that's the insertion. What's the origin of this muscle?
The insertion is
The origin.
the origin is the acromion process and the lateral quarter of the clavicle
Lateral 1/3 of the clavicle, acromion process,
and scapula.
spine of the scapula.
Spine of the scapula.
Cool. Hey, what's the insertion for the trapezius?
Same.
Yeah, I'm sorry, but I'm old.
Oh, sorry. No, I mean, right, that's the origin.
No, it's
right?
correct. You were right.
No.
The origin of the deltoid is the insertion of the trapezius. So can you just tell me that again, though? What is that?
That is the spine of the scapula, the acromion process, and the lateral third of the clavicle.
Nicely done. Hey, I'm sorry. I'm not trying to abuse you, but there's lots of other questions about deltoid. What do the front fibers of the deltoid do?
flex the shoulder,
Yeah, what do we call the shoulder?
the glenohumeral joint,
Yeah. What do the rear fibers do?
extend
Yep. The what?
the glenohumeral
Oh,
joint,
good. What do the middle fibers do?
abducts glenohumeral joint.
And by the way, I'm not even listing all this stuff. The front fibers can do a little bit of a medial rotation. Rear fibers can do a lateral rotation, things like that. But fantastic. Thank you. Thank you.
Thanks.
But we're not. We can't. I just can't do it again. Boom. Miss Hawks, what muscle is this?
That is the latissimus dorsi.
Latissimus dorsi. Yeah. And by the way, it's 4:30. I'm gonna stop right there. Guys, it's 4:35. I realize. Let's take a break till 4:50. You guys have been great. We'll come back. We'll learn about the calf muscles, and we'll get you on your weekend, all that good stuff. Yes, Mr. Tate.
Are you recording this?
I am recording this once, but now we're talking about it just a little bit more explicitly. All right, let's see here. Here's a beautiful picture of a person with no skin having a foot bath, I think. I don't quite understand that. Can you hear me? Oh no, we've lost each other completely. Wow. All right, guys, I don't know if you can hear me, but I'm frozen. I will get back on here in a second. Not sure what's happening. Bear with me. Wow. Okay. Possible? Okay. All right. Let's see if I can present now. Now, hopefully you're seeing a picture of somebody with no skin on their feet getting a foot bath. Don't understand the point of that, but I guess, probably should keep them sterile at this point since there's no protective outer coating. All right, we're going to talk about 3 muscles today. The 3 calf muscles. The plantaris, the soleus, and the gastrocnemius. Yeah? Am I cutting out or am I coming in pretty clear now? Okay. And thank you. And the popliteus. We threw the popliteus in because you're going to see why, because it's right back there next to the plantaris. And so it just seemed like to make sense from getting used to this area. Okay. Here is a beautiful picture. I'll show you a couple more beautiful pictures, by the way, in a minute. But a beautiful picture on the left-hand side is what you are used to massaging, except you have skin on your calves. But still, this is what you're used to massaging. On the right-hand side, they have only cut away the gastrocnemius, and the hamstrings. But they've cut away that so that you can see the soleus underneath, and the plantaris, and the popliteus. Please note, the tendon of the plantaris becomes your Achilles tendon. The tendon of the gastrocnemius becomes your Achilles tendon. The tendon of the soleus becomes your Achilles tendon or your calcaneal tendon. Yes, Miss Trotter.
Is that why if it ever gets cut or something, you can't walk?
Oh yeah. So I'm glad you brought this up because of course we have to cut somebody every lecture. Yeah, the gastrocnemius, the plantaris, and the soleus all eventually join together and use the same tendon, and it goes into your heel, your calcaneal bone, your calcaneus, and that's why it's called the calcaneal tendon, but most of us know it as the Achilles tendon, and you are screwed if it gets cut, so to speak. I mean, they can fix it. I don't mean like you're going to die necessarily, but you cannot walk. It's super, super serious. And all those muscles are under tension. So not to be gross, but just because I know Miss Mejia likes lots of detail. If you cut this thing, those tendons and those muscles will shoot up inside the leg and they'll ball up here. And they'll actually have to reach up there with, I'm not making this up, they'll reach up there with forceps and pull it back down and have to screw it into your heel, and then it takes months and months to heal. Wow. Yeah. I didn't mention the blood. So anyway, okay. Anyway, here's the other interesting thing. It is the strongest tendon in your body. The strongest tendon in your body. It can withstand thousands of pounds of pressure and force, and yet it is the most commonly ruptured. So what does that tell you? How can it be the strongest and yet the most commonly ruptured? It reasserts what Tapscott's been saying, that the amount of force on this area, yeah, oh yeah, they do. Yeah, I can't think of a worse way to jack somebody up, because they'll live, but that's, yeah. And without really good medical care, they're going to be, yeah. So, I mean, yes, there are all sorts of historical reasons why people cut them, like to keep people from running away and all sorts of stuff. But anyway, this area, remember I said it's a lever that works against you. It works for speed, but not power. So I said to lift up my 200-pound body, I actually need about 2,000 pounds of force behind here. It shows you how much tension that area is in. Yeah. And actually one of the best things you can do to prevent from rupturing it is staying hydrated. Because, and I don't want you to freak out if you're dehydrated, you're going to out of bed and blow your Achilles tendon. You're usually doing something athletic. But water keeps your tendons supple and elastic so they don't tear. Water is actually very key to your tendons and ligaments and muscles functioning. So it helps keep tendons from tearing, being hydrated, because you don't want your tendons dry and brittle. You want them soft. And it's true for muscles too. Not so much tearing, but muscles lose about 80% of their power when they're dehydrated. This is why they tell you to take water on hikes. Everybody just thinks, oh, I just can't get dehydrated on my hike because that's not good, but I can last for a while without water. Yeah, you're right. Because what happens is people hike down in a canyon, they run out of water, and they're not in danger of dying from lack of water. They've got a couple of days, but they are dehydrated, and now they've lost 80% of their power. Well, if I lose 80% of my power, it's like putting a 400-pound man on my back and trying to hike out of the canyon. And that's what gets them. They run out of water and they lose body power. They could lay at the bottom of the canyon for 2 days and survive if somebody finds them, but they lose all their ability to hike out. Your muscles really need water to function at a high level. Hydration is super important. Okay. I also hope you'll notice that when this gastrocnemius is cut here in this right-hand picture, that you can see that it does truly indeed cross over the knee joint and grab onto the condyles of the femur. That's what it does. It's a double-bellied muscle that grabs onto the condyles of the femur when it reaches across. So let's look at these in a little bit more detail. Yeah. God, the human body's beautiful. Okay. All these muscles help in plantar flexion. We have always learned about the gastrocnemius, the soleus, and the plantaris, but we also learned there were some muscles underneath them, remember? And there's a great picture here on the right of the tibialis posterior and the flexor digitorum longus and the flexor hallucis longus, which are all underneath. And all 6 of those muscles help with a plantar flexion. It's not their main job, but that's what they do. It is the main job of your calf muscles, however. Okay, gastrocnemius. 2 actions, right? Number 1 action is to create a plantar flexion. To plant my feet so hard that I lift myself up, right? They pull on the heel, but that pushes down on the toes. They pull on the heel and that pushes down on the toes. But the gastrocnemius also crosses over the knee, so it can help you to flex the knee. So if somebody came to you with knee problems, it would not be crazy to work the sides of their knee, not directly in the center of it, but their sides of the knee to kind of work these attachments out. And so its origin is on the condyles, the bumpy back parts of the femur. That's why it says it attaches to the condyles of the femur on the posterior surface, because those condyles are big bumps here, and it's saying it's on the back side, which makes sense. And then it inserts into the calcaneus via the calcaneal tendon. Do you remember this language before? Remember the quads that insert into the tibial tuberosity via the patella and the patellar tendon and ligament? They're saying the same thing here. They're saying it inserts into the calcaneus via the calcaneal tendon because it shares the calcaneal tendon. right? Like the quads, I know those are 4 muscles, but these 3 muscles come down and all insert into the same spot too. Okay? Cool, cool, cool. Then underneath that, if we tear off, well, Miss Trotter prefers that we just cut it. If we cut the gastrocnemius off, we got to cut at the top of the 2 condyles, we got to cut it off the calcaneal tendon, and we rip that thing off. Underneath, we see the soleus. And the soleus does not cross over the knee joint. Yep, which is why it only has one action, plantar flexion. So there's no exercise. Let me think if this is true. Hold on. There's no way you can do a plantar flexion without using your soleus. There are ways to do a plantar flexion without using your gastrocnemius, because you can make it loose by bending your knee a lot. But the soleus is always working. The soleus is kind of like the brachialis underneath my bicep. It's very similar. Bicep runs across 2 joints, gastrocnemius runs across 2 joints, soleus runs across 1 joint, brachialis runs across 1 joint, and its job all day long is to plantar flex, and it's amazing. It's powerful, it's thick, and by the way, it's wide. It actually sticks out on the sides of the leg. In fact, to access it, I often come in from the medial and lateral sides, which a lot of you got in your homework. Yes, Miss Vincent?
So, like seated calf raises, is that just soleus then?
Yes. And that question was brilliant and shows real understanding. And the reason is, yeah, when you go across that knee joint, if I bend the knee joint down, the gastric's kind of flopping there. By the way, I don't know if it's 100% disengaged, but it surely can't fully contract. Yeah. And by the way, just a little side note, for those of you that are into fitness, some personal trainers, and I agree with these personal trainers, recommend not doing a lot of seated calf raises because it creates this big imbalance. Your soleus is always getting a workout. It doesn't need a focused workout. It's always getting worked out. So they prefer you do like donkey calf raises or standing calf raises, all those things where your knee is straight so that you're working both at the same time. Because you really don't want huge imbalances, and the soleus never gets a break, so there's no point in focusing it. Make more sense to focus on the gastric, which you can't really do. Yes, Miss Mejia.
So the soleus is kind of like at that diagonal angle there, so it's not completely symmetrical.
Absolutely, it's not. Yeah, it's not. You're absolutely right. And that angle, I mean, I don't know why that angle exists. I have no idea. I don't know if anybody does. But that angle is the angle of the soleal line. There is an actual ridge on the back of your tibia, which you can't feel because there's all this stuff on it. But that's the soleal line. And the soleal line is this line on the back of your tibia, on the proximal posterior surface of the tibia, that the soleus hooks to. And then, of course, it inserts into the calcaneus via the calcaneal tendon. So you know I'm going to ask you that question. I'm going to be like, where do all 3 calf muscles insert? Just like I asked you about the quads. And you're going to say they insert into the calcaneus via the calcaneal tendon. It's a beautiful muscle. But so when I rub calves, I try to rub them on top, then I try to go to the sides and actually try to get my fingers to meet in the middle. They won't. But so I can hit underneath the gastrocnemius and get into the soleus. Yeah, really, really important. And some of you in your homework said some really clever answers. We said, how do you work the soleus without working the gastrocnemius or whatever? And I was looking for you come in from both sides like I just said, but some of you correctly also said you could bend the knee and make the gastrocnemius loose and go in through the gastrocnemius, and that's true. That wasn't exactly what the question asked, but it's excellent thinking. When you bend the knee, the gastrocnemius gets loose, it's not taut, and I can push through it very easily to get to the soleus, right? I'm not actually going through it, but I'm making that tissue soft so it's not stopping me from getting the soleus. So it's one of the reasons why I often work people's calves when they're face down, prone, with their knee bent, because nothing's affecting me to get to the soleus. And I like that. Yay. I'm not saying anything here. I'm not going to say anything. I don't have a profound point to make. But I would like you to look at how much of the leg is consistent of, this is a leg sawed off, by the way. This is why I get so violent. I'm sorry, Miss Meek, the boy. Okay. This is a leg we just happen to find perfectly preserved like this. Anyway, I think it's very interesting if you look at how much of the leg is muscle and how much is bone, especially on the back side. You can see the calf muscle there, the soleus, the gastrocnemius, and then you can see it even closer to the bone there. That's the posterior tibialis and the flexor digitorum longus and flexor hallucis longus in back. And then up in front, we will get to these later, but that's the anterior tibialis and the peroneals and fibularis and all that stuff. I wasn't trying to make a point, I just think it's good to see proportions. Because when we're working on people, we forget their bones are about that big around, even though their legs are that big. Which means all that's meat you should be working on. Right? There's a lot there. A lot there. Okay. Here's the little adorable plantaris, which is actually kind of deep to all of these. This is why I say it has the longest tendon in the body. If we don't count the IT band of the tensor fascia lata. Notice the actual contractile tissue, the actual muscle is about the size of my thumb with this huge long tendon coming down there. They're showing it going all the way down the heel, but just remember it actually blends into the calcaneus and the calcaneal tendon, right? Its origin is on the lateral supracondylar line of the femur. Don't even worry about what line means. There's a little line back there. It's on the lateral supracondylar ridge. Supracondylar femur. Just like the gastrocnemius, really. Except the gastrocnemius goes to both sides. And most massage therapists, including myself, don't really worry that I'm hitting this one little muscle. I do try to work across the knee, though, when I feel like there's knee tension that could be coming from any of the calves. And again, plantar flexion and weak flexion of the knee, because it's a tiny little muscle. By the way, a lot of people think this muscle is left over from some Darwinian thing, and it might be, and you don't use it anymore. But there are some other really interesting theories about this muscle that I like. I don't know. Zero idea. But I like these theories. I like them because bodies are much more complex than we realize. But some people think that muscle is literally there to tweak the tension of the other muscles. So, when you have a rocket and you shoot it into space, you have a main engine, right? But you have tiny little thruster rockets that are like little bottle rockets that make sure that thing stays straight. You need that with really powerful muscles too. So it's quite possible the plantaris helps help align your ankle when it's being pulled too far to the other side by the other muscles. It really could be a little tweak muscle that kind of gives little nuanced tweaks to things because your bodies are extremely precise. The movements you do are extremely precise. And then we have the popliteus, which is not a calf muscle, not part of the calf muscles, doesn't do anything the calf muscles do, but it happens to be found nearby them. And it kind of runs across the knee like the plantaris, so I wanted to show it to you here. And what is the nickname for the popliteus? Yes, Miss Vincent.
The key that unlocks the knee.
Yeah. And it really is designed, so this is kind of hard to show you, but if you think about it, if my leg locks out completely, okay, just pretend this with my bicep. My bicep here, yes, its job is to pull this arm up here, but when it's completely out like this and it pulls it, it actually just kind of pulls it into me. I need to bend a little bit before I can pull. And the key that unlocks the knee actually unlocks your knee so your hamstrings can finally get a hold of them and pull them. They don't have a lever to pull onto. There's no lever here until I give it a lever. And so, just like horses, we can kind of lock our knees, right? And that popliteus unlocks them so my hamstrings can kick in and bend my knee. For this reason, we don't believe it's a typically problematic muscle. It doesn't work very often. It might get a little bit tight, and regular massaging should kind of catch that, but we don't think it's like the culprit of major problems because its job is just to pop the knee open and it usually doesn't create other problems. I'm not saying it never does, but I'm just saying it probably doesn't too much. But again, it's grabbing onto the lateral condyle of the femur just like the plantaris. They're actually rather similar. And its job is to open up the knee. And it is palpatable. It is palpatable, especially from the medial side of the tibia. In fact, there's a good picture here, right here. That's what that guy's doing. So, I thought I'd show you this picture too, because I think it's a very good example, again, of where these guys lie. If you cut the gastrocnemius, you can kind of see the popliteus here underneath it and the plantaris there, all running there. And you can even see where the tendons run and all that good stuff. And remember, the plantaris and popliteus actually come from the medial side of the tibia as they move proximally across the knee joint to the lateral side. So on me right now, behind me, they kind of go whoop, whoop. Now, this question has been asked before, but I just want to repeat it so that you guys know. Yes, we don't rub in knee pits. We don't rub in the popliteal pocket. But that pocket was formed by very thick tendons on the side, and you can easily run over the sides of the back of a knee. There's nothing wrong with that. Just don't dig directly in there. And again, I know I keep saying this, but I just don't want anybody to miss this point. Just like I can rub the heck out of the things that make my armpit, my axillary region. I wouldn't have an axillary region. You don't have a valley if you don't have mountains. These are my mountains. I just don't poke straight in there because there's no mountain in there, and that hurts. So we don't poke straight back in the knee because there's blood vessels right there. But the sides you can be quite aggressive with. They've got lots of tendinous attachments. The hamstrings are coming across from the top. The gastrocnemius is coming across from the bottom, and the popliteus is in there, and the plantaris. You can rub those sides. Don't be afraid to get in there with your thumbs and stuff. Just don't push right in the center where there's no muscle. And if you are in the center, be thinking to go outside. So even when I'm kind of there, I'm kind of pushing out instead of pushing in. I'm trying to go out to those walls. But I don't want you to be afraid of knees. We tell you that when you first start, because we were like, don't put your finger in somebody's eye, don't stick it in their armpit, don't put it in their knee pit. But now you're getting more advanced. We actually want you to work that stuff. We just want you to work it judiciously and thinking about what you're doing. Make sense? Kind of, sort of? Cool. All right. Questions? Thoughts?